Let's talk more about this now here on LBC News. Delighted to say I'm joined by Dr. Layla McCay, Director of the NHS Confederation. A very good afternoon to you, Doctor.
Good afternoon.
Thanks very much for joining us here on LBC News. So, what are your thoughts on the latest figures that we're seeing?
I think that NHS leaders are not alone in being quite concerned about this quite significant rise in figures and what it's going to mean.
And what's going on with the testing system? We're hearing a lot about people having to go very far to get a test, not being able to get a test, the website not working. Are these isolated incidents, or is this happening right across the country?
From what we hear, this is a fairly widespread issue. Apparently, there has been a limitation in how much the laboratories have been able to process testing, and that has halted or reduced the amount of tests that are able to be carried out in various places around the UK, which is why people have been receiving these ridiculous messages telling them to travel hundreds of miles to go and get a test. Clearly there's been a lot of concern about this, particularly because we're also hearing about how the capacity is about to massively increase.
So is this an issue with the labs or manufacturing the tests? What is it? Do you know?
We're trying to get to the bottom of it, but from what we're hearing from the people who are running the system, it is currently an issue with the labs. What that specific issue is, we have not yet been able to clarify, but certainly if the government has hopes of meeting its grand ambitions to massively scale up testing, issues like this are going to have to be solved.
Yeah, we'll talk about that in just a moment. Just tell me how important testing is to beating COVID-19.
Testing is incredibly important because in order to stop transmission of this disease, you need to know where it's happening. You need to know who the people who might have been exposed are, get in touch with them, get them to isolate. That's how you break the chain of transmission. If somebody is not able to access a test, then, well, it can have a number of ramifications. But if you can't get a test, ideally you would isolate, but feasibly you might persuade yourself you have a cold, go about your business and infect people. And the numbers of COVID cases could really increase if that were to be the case. There's particular challenges to our members throughout the NHS, whether that's in hospitals, whether it's in GP surgeries, right across the NHS. Even staff members have had challenges getting their tests in time recently, and what that has meant is that they have been required to go and isolate and taking them away from delivering services, which is another challenge when the services are trying to get back up and running, treat as many people as possible, but actually people are stuck at home waiting for a test.
The Health Secretary said that too many people were getting tests without symptoms. Do you believe that's the case?
It may well be that people who are needing tests for particular purposes might be accessing tests, but what we do know is that these tests work best when you actually have symptoms, and certainly in a situation where there does not seem to be quite enough tests to meet the growing demand, really we need to be prioritising people who are experiencing symptoms. So if you've got a new cough, if you've got a fever, if you've got a change to your taste or your smell, then these are the things that should send you to get a test.
And what do you make of Operation Moonshot, the plan that would see millions of tests carried out daily? I mean, if they're struggling to do the number of tests that they need to do at the moment, do they need to be sorting out test and trace as it stands currently?
I think it's a big concern when the government is promising to do a massive scale-up of something that is struggling at its current size. What we really need to see is evidence that this is going to work, and really believe in it and understand it so that everybody can really anticipate it. At the moment, it's not quite clear exactly what the details of this are and how such a moonshot could be achieved. And we've heard various experts opining on this, and lots of them have got concerns. I guess that from my perspective, what we want to see is a system where testing is available to anyone with symptoms, and where the test and trace system is so good that it is picking up the contacts of the people who are positive for COVID-19 so that they can be contacted and isolated. And that system needs to be working better than it is now. That's really the bedrock of this system of reducing transmission.
Well, one firm claims its machine does a test result in 20 seconds. Would you believe that?
Possibly. There's all sorts of really innovative, exciting technologies being developed at the moment. Again, we would want to understand the accuracy of the results that this was delivering. But if it is delivering something that works well, that works fast, that is easy to access, then that would certainly be all to the good for the many people who need tests so they can make informed decisions about what to do next.
And is the government using this Operation Moonshot as a backup if we don't get a vaccine, so that potentially next year, if this vaccine hasn't appeared by then, we could potentially have a more normal summer than we've seen this year?
I think that there are lots of different ways in which we can help people start being a bit closer to each other, moving around a little bit more like normal. And there are all sorts of different things that you could do, and it's quite sensible to be looking at a wide range of them, because we don't yet know which ones are going to be the most useful, which ones are going to be the most effective.
And I mentioned summer, of course. That does seem quite a long way off at the moment. How worried are you about the impact of the virus as we head into winter?
It's incredibly worrying. As I think everyone knows, winter is always a really challenging time for the NHS. There's always a surge of various types of infections, other diseases that are exacerbated in different ways during winter that are nothing to do with COVID-19. So that, plus a possible surge of COVID-19, plus we have the NHS working incredibly hard, bringing back services, trying to keep a bit of capacity in case of a COVID surge. Staff who've been working flat out for months and months who need a break. All of these things coming together, along with social distancing within healthcare facilities, sorting out PPE, infection control mechanisms. There's a lot that NHS organisations are having to deal with at the moment. And if there were to be a rush of cases of people who have more severe forms of coronavirus needing hospitalisation, needing various other types of healthcare, needing rehabilitation, that is a huge extra demand on an NHS that's already working really, really hard to help patients. So we are hoping very, very much that people will be able to work together to keep the numbers down, to keep people healthy and safe, and reduce the transmission. But that is an effort by the public with social distancing and hand washing and ventilation and masks, etc. It's also an effort of the testing and the tracing systems to be working really, really well. And if all of those things come together, then hopefully we can nip this in the bud.
But it might not, and we could have a terrible winter.
That's absolutely right.
How bad could it get?
Well, that remains to be seen, but certainly various projections are really quite alarming, suggesting really quite large numbers. We don't know what that's going to be, because there are actually, well, first of all, this is a new disease and we don't know exactly how it might behave over winter, and second of all, there are so many variables as to whether the various mitigations that people are putting in to reduce the surge, whether they will be effective. And we don't know what the impact of all sorts of different decisions are that we're taking, because this is a new virus and we're learning all the time. But I think it would be hard to make predictions, but this is a situation of hope for the best, prepare for the worst. 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 For the worst.